Welcome back to TV5 News at 9. It is time now for Aging in Style with McLaren. And joining us now is Dr. Nicholas Mawad. Thank you so much for being here, Doctor. How are you today?
Good morning. How are you guys? Glad to be here. Really happy to be here.
Yeah, we're glad to have you. We're doing well and, hanging in there. So today we are talking about peripheral arterial disease. So, Doctor, first off, can you just tell us a little overview of what exactly this is?
Yeah, peripheral arterial disease, also known as peripheral artery disease or PAD, really has to do with narrowing and blockages of blood flow to your extremities, primarily your legs. Over the course of time, particularly as you're aging, you can develop some plaque or some buildup of fatty tissue in your blood vessels, which can cause some problems later down in life. And that's what peripheral arterial disease means.
All right, good to know. So what are some symptoms that somebody should be on the lookout for?
The most common symptoms are really pain with walking. You can walk a certain distance, you might have some cramping, aching, dull discomfort, particularly in your legs. And when you rest, the pain tends to go away. That means that your muscles are not getting enough blood flow to do the activities they generally want to do. And we see this very commonly as people get older.
Hey, doctor, real quick, is there more physical symptoms, or is it pretty much you got to listen to your body?
Well, I think it's important to start listening to your body first. Of course, this can progress into very dangerous things such as ulcers, wounds, even gangrene that may lead to amputation and death. So picking up on this early is very important.
Yeah, we'll definitely get to that in a minute. But what are some risk factors in developing this disease?
Well, so it's actually a testament to the great care that's given here in the United States. Our patients are getting older, people are getting older.
Yeah.
And so as you get older, there's a higher chance of patients that are over 55 that develop narrowing or blockages, particularly in the arteries of their legs. It's around 20 to 40% of people over the age of 55. But importantly, evidence or blockages in the blood vessels of your legs can also be a marker or a surrogate for blood flow blockages in your neck, such as your carotid, which can cause a stroke, or even at the level of your heart, which can cause coronary artery disease or a heart attack. So these are very important to keep in mind, particularly having blockages in one part of your body may be a marker for somewhere else in your body.
Yeah, I guess that makes sense. Now, doctor, early detection, you said, of course, helps, and it helps with any type of disease. So why is this so important to catch early?
Well, again, like I said, it's always easier to be able to deal with these things sooner rather than later. And again, finding blockages in your legs can be, again, a marker for those in your neck or in your belly and so forth. So being able to manage this early on can decrease your chance of wounds, ulcers, gangrene, amputation, and even death. So again, it's important to be on top of this soon because it's a relatively common condition for patients as they get older.
All right, so you said that there was some pain in your legs, which could be an indicator. So how do you really know whether it's time to see a doctor or not?
Well, I think at any point when you're not sure or you're concerned, you should always check in with your primary care provider. You let them know about the difficulty you're having with pain in your legs or other concerns that you may have, and then they can always refer them on to us who manage this stuff very frequently.
All right, that leads into my next question, Dr. Mawad. Where can people receive these type of screenings?
Well, we here at McLaren are very aggressive about screening for peripheral arterial disease and other vascular disease, as a matter of fact. We're actually hosting a Facebook Live on our McLaren webpage on September 15th at 5:30, so you can tune in for more specific questions and management options for patients with PAD. I'll be there to help with that. And we're hoping to do a few screening programs later on in the fall for the community so we can take care of our patients right here at home.
Yeah, absolutely. What a perfect opportunity. Dr. Mawad, thank you for being here. Is there anything else that you would like to add before we go?
No, just make sure you see your primary care provider, or you can see us at any point. We'll be happy to take care of you.
Well, it was a pleasure having you on this morning. Thank you.
All right. Thank you guys very much and have a great day.
You as well. All right. For those of you at home, if you want more information, just head on over to the Aging in Style page on our website, WNEN.com.